Hi, everyone. My name is Nicole. I'm going to be your host for our live tour today. We also have another student. His name is Noah. He's going to be filming our tour. And then we're also joined by Wendy, who's part of the staff for our nursing program here at UNH. You'll see very soon they are right now in our brand new Health Sciences Center. So they'll be able to give you a tour of that, which will be awesome if you're interested in coming to UNH for nursing or other health science related fields. That's definitely open to you as well. But today we're definitely going to focus on everything nursing. So definitely get your questions ready, whether it's about nursing or if you're interested in something related, you're trying to figure it out, all are totally fine. Any and all questions you have about UNH and nursing, we'd be more than happy to answer for you. You have a chat feature on your screen, like a YouTube chat feature. Feel free to use that as much as you can. Let us know all of your questions. So that way we're helping you out as much as we possibly can. It is just 3 o'clock now, so we'll wait a few minutes, just hopefully for a couple more people to sign on as everybody's getting ready. So as people are joining, again, just reminding you to ask questions, and I'll introduce myself. So my name is Nicole. I'm a senior here at UNH. I'm a neuroscience major. So I am familiar with a lot of like biological sciences classes, things like that. But we are joined by an awesome member of our staff who is familiar with nursing today, who's going to be able to answer all of your questions about nursing. And then we're also going to see some of the facilities for nursing on our campus today. So with that, I'm going to turn it back over to you, Noah and Wendy. Give us an introduction and get us started.
Sounds great. Thanks. Welcome. I'm Wendy Caban. I am the department coordinator for the nursing department, which means I handle all of the process of running a nursing department, hiring people, student records, registration, things like that. Today, I'm happy to show you our new Health Sciences Simulation Center. We'll talk a little bit about what the nursing program looks like, what our curriculum is, what makes us special. We'll take a tour of the building. And then afterward that, we're going to be joined by some current nursing students who can answer some questions about what it's like to be a student here in UNH. So first thing, the nursing department is an accredited program. We just finished our accreditation last fall with the Commission on Collegiate Nursing Education. And we offer a whole bunch of programs of study. We have the traditional 4-year bachelor's degree, which most of you are interested in, but we also offer programs in Masters of Science for people who would like to be a nurse practitioner, people who would like to be a clinical nurse leader. Perhaps they're interested in being a psychiatric nurse practitioner, an acute care gero nurse practitioner, or even a doctor of nursing practice. You can go all the way with your nursing education here at UNH. We're going to talk a little about the curriculum. So we are a direct admit program. Students can be admitted directly into the program as a freshman, and they can stay in nursing as long as they meet their basic eligibility requirements, pass all their classes with a minimum grade. So there is no pre-nursing and then reapplying once you're admitted. So students who are admitted right into the nursing program as freshmen begin taking a few nursing classes as well as their prerequisites. They'll take anatomy and physiology 1 and 2. They'll take an English course if they need it, psychology. They'll also take an introduction to professional nursing and a nursing research course. In the sophomore year is when clinical starts. That's when the students go out into the hospital settings and begin the hands-on work of being a nurse. So for once a week for 7 hours, student groups of 8 and 1 instructor go to long-term care and rehabilitation hospitals in the area to do the hands-on work of caring for patients. Also for 2 hours a week in their sophomore year, students come into this room here, which is our low fidelity simulation or skills lab, where they learn the hands-on of taking care of people. We have this space can be configured and changed to meet our needs. We have task trainers, and they have an opportunity to learn how to do it before they try it out on a real person. We also offer for those who need a little more time, they can come back and do some open lab time and perfect their skills with an instructor. So that's the spaces that is used mostly by sophomore students in their first semester. Junior year curriculum gets pretty busy. Our students in our junior year take 2 semesters of medical surgical classes, which have a full day of clinical for those. We use all of the hospitals in the area that are within a reasonable drive. We go to, if you're familiar with the area, we go to Wentworth Douglas, Exeter Hospital, Portsmouth Regional, Southern New Hampshire Medical Center. We'll go up to the New Hampshire State Hospital, Those are some of the ones that we use for our med surge. They'll also take 1 semester of maternity and childbearing, and they'll take 1 semester of mental health. Both of those also have a clinical day attached to them. So junior nursing students are out in the hospital setting for 16 hours each week. The rest of the time they're taking classes, including the med surge, mental health, the maternity, and additional courses in nursing research. Senior year, students have a focus on pediatrics as well as public health. And then we have our senior practicum. And our senior practicum is one of the things that sets apart from other nursing programs. It's a very intensive one-on-one 252-hour immersion in a precepted setting, which means you are paired with a nurse who's employed by a facility, and you work side by side with her, learning the ins and outs and the final part of doing the job of being a nurse. We have a full-time staff person who finds clinical placements for our students to do this. We try to match them with their interests and where they want to go. And we usually are very successful at matching both. Occasionally, we'll have a student who needs a little extra help on certain skills, in which case we will hand pick a preceptor to make sure that they are getting all of their educational needs met and that they are graduating prepared to be the best possible nurse that they can be. Those precepting sites in the senior year are a little more flexible. We have some great options available for people to do that. They can stay here in the New Hampshire Seacoast region if they'd like to. They can also go down to the Boston area if they were interested in, say, working at Brigham and Women's or perhaps Boston Children's Hospital. They can also go way up into the North Country to a magnet hospital up by the border for a program called Rural Scholars, and those students live there and they take their classes remotely and work in a magnet hospital. There are advantages to all of these locations, and everything is, it allows people to have a customized experience to do something that fits their interests and where they want to do it. One of the things that's kind of unique as well is that we do have an ability to do an international study abroad semester. So we have short-term trips that happen in the summer and in between the semesters. But if you would like a longer-term study abroad experience, the fall of the senior year, you can make that happen. So if you are interested in going to Nepal, Zimbabwe, the Netherlands, Denmark, these are all places that students have gone recently to travel, and Japan, they can have that immersive experience in another country while still completing their nursing degree. If you want to stay a little closer to home, you can do semester in the city and go down and live in the Boston area and finish out your fall semester of your senior year in Boston. So there's lots of variety and ability to kind of make the program something that fits your interests as well as becoming an outstanding nurse. We offer an honors and major. So students who are interested in pursuing research can have an opportunity to work with faculty members to work on research projects. That is, we are an R1 research institution, which means we have very high level research activity across the entire university, and nursing is no different. We have students who work with faculty in the nursing department or in the biomedical science department, or even off campus in various hospitals and facilities in the area to complete research projects. And they're given an opportunity to present that body research to the community as well. So we are really excited about the opportunities we have for research for students who are interested in pursuing that. We even have an opportunity for a dual major for those who are interested in international affairs and have a good language background. That's another opportunity as well. Students can minor if they're interested. Women's studies is particularly popular, so is psychology. So that is something that isn't available to you to kind of further enhance your education. So one of the things that people always want to know is, how do our students do on the NCLEX exam? The NCLEX is that licensing exam that you take after you graduate to get your license as a registered nurse. We will help you with all the paperwork for that. You're eligible to take the licensing exam in any state. And we do that paperwork, and they do very well with that. Our last group graduated with a 95% first-time pass rate. And one of the reasons that they do really well with that is that we use a program called ATI. And ATI mimics that NCLEX exam. If you're going to go in and take that standardized test at the end of your program, you might take 1 question, 3 questions, 5 about maternity. But here, when you finish your maternity course, you're going to take an ATI exam that's going to have 50 or even 100 questions that are the same as you might have on that NCLEX exam. So it gives you an opportunity to be exposed to it, to be practiced with it, be more comfortable with it. And students go in to take their exam and find that they do extremely well, and it's not that stressful for them. So we're really pleased with how well they've done with their licensing exam in the past. So we can talk a little bit about our Sim Center. So this opened in November of this year. It was budgeted, we had a funding from the state of New Hampshire for $9 million, and it is a 13-bed hospital, basically. We have 4 medical surgical suites, maternity, a critical care. We have this space here, which is designed to be flexible to use for the skills, the hands-on of it. So we have the mannequins that can be used for practice. All of our equipment is actual hospital functional equipment that we purchased. So everything does move and work just the same as you might find in a hospital setting. We have task trainers. For example, they were working earlier on IV changes. So we'll have task trainers, which are small items that are designed to look like what you care for when taking care of a patient. And we will practice on these and on each other whenever it's appropriate. So let's head out into the hallway and go over to our high-tech skills sim lab. So
Wendy, while you're walking, somebody
Yes.
asked how competitive is the major. I'm not sure if they asked to like be admitted or while you are at UNH, but maybe if you want to speak to both of those.
So sure. So admissions decisions for the program are made by the Office of Undergraduate Admissions. They tell us that for the group that started in the fall this year, they received about 1,600 applications. We do know that nursing students apply to a lot of schools. If you tend to get into one, you got into a lot of them. So they offered admission to about 400 of those students so that we can have a starting group of 96 is what we're looking for our incoming class. So it is competitive, but there's lots of opportunity. For those who don't get admitted as freshmen, there is a transfer process for students who come to UNH under an alternative major. Maybe they got into as undeclared. If they take the prerequisite courses, they can apply to have one of the seats to start as a sophomore in the nursing program. So that's another option. It is competitive. There's no guarantee that you'll get in that way, but it is one more way that you can get into the nursing major. So this is the simulation wing. So we're going to come on in here. So students who are preparing for their simulation will start here and come down the hallway. This is designed to look like a hospital setting. So we're going to go down around the corner, a little bit of a walk. We have a dim briefing room where they can meet with their instructors after they're done to determine how well they did. Their encounters are recorded and they can watch back their work on that screen. These are the 4 medical surgical rooms. Outside where we have the personal protective equipment, just like you would use in a hospital setting. And I'll go check on. Come on in. So this is what the room looks like. So our mannequin here is our patient. Our students know what their patient's history looks like ahead of time. They know who they're taking care of, what their medical conditions are, what their medications, their most recent lab tests, maybe their social history. They'll have all that, and they're expected to kind of do a little research and be prepared. Simulation runs for about 20 minutes. They do it about every other week, starting in the 2nd semester of their sophomore year, and they go all the way through till graduation. It gets progressively more complex. On the On the other side of the glass is our lab assistants who not only control them, voice the mannequin, our patient, but they also will help the student by debriefing with them after the encounter about what went well, what they can do better. Many of our lab assistants are alumni from the nursing program. They are all licensed nurses who work full-time in other facilities, and they come back and teach with us because they enjoy it quite a bit. So what we're going to do is we're going to sneak into their side of the glass, which is going to be the side that the lab assistants work on, so that we can see someone who's doing a simulation in the building, the room right next to us. This is going to be challenging. Yes. Keep the student going. So this student is in the middle of her simulation. Crystal here is watching her work and evaluating how she is doing. And when they're all done, they'll get together and kind of talk about what maybe she, opportunities that she missed, something that she did particularly well. Sometimes it's something as simple as just showing a better way to handle something. Crystal's been teaching with us for what, 3 or 4 years now? 4 years now, so she keeps coming back and giving us a hand because we appreciate how great she is at her job and how much she knows. So these are the traditional med-surg rooms. This is more like people who have that had maybe had surgery or have a major injury that they're recovering from. We also have other rooms in here that are specialized, including our critical care suite, which is designed to look like an ICU room. So we're going to sneak around to that one by cutting through. So one of the things that we offer is we offer some electives for students who want to go more in depth into what they're learning. And we offer a critical care course. These are students who want to learn more about caring for people who may be in the ICU or be severely ill. So this suite is designed to mimic those situations. Those students will take additional courses in advanced cardiac life support. They'll learn more about heart arrhythmias. And this room is outfitted with, for example, an AED and defibrillator. There's a crash cart. And this gives them a chance to get more in-depth knowledge and more skills that they can take with them when they graduate. We also offer an elective in palliative care, which is not necessarily end of life, but quality of life care for critically ill, chronically ill patients. And so that's a new program that's being offered as well. It's a class to kind of expand your knowledge. It's an elective. And that has been really well received. We have a great instructor who has a tremendous amount of experience in palliative care who's leading that, and it's getting some great reviews as well. Next door to this room is our family birthing suite. We'll go back out into the hallway to access that one. So this room is set up to be a family birthing suite for maternity. Our mannequin can give birth. She can have a post-surgical C-section that needs care. She has a newborn. All of these are fully animated, and you can get breath sounds and pulses. They'll move, they'll blink. The baby has can do an APGAR score on it. We're also prepared for pediatric crash. So for this example, this has all of the items that you would find in a pediatric crash cart. And then this is for the hemorrhage care. So it has items that you would find for caring for a maternal hemorrhage. We do know that babies like to come at 3 in the morning. We also know that moms sometimes want to make that a private experience. So we can't always control how many births a student is going to get to assist in and see when they're in the clinical setting. But by having this set up, We have plenty of opportunities to have all the different types of scenarios for childbirth available, and we can control the environment and you let everyone have an opportunity to have that hands-on experience for caring for both a mother, a laboring mother, and for her new infant. And then finally, we did talk about this, is that you can continue your education here. We do offer a primary care family nurse practitioner program for those who want to go into caring for families. And so for that, we have exam rooms, which are designed to mimic a doctor's office. And we, several times throughout the year, we will bring in actors who serve as patients for our students to have an opportunity to examine, to interact with, and then they are evaluated both by their instructor and by the patient to see how they're doing. So we have lots of opportunities here. Undergraduate students, by the time they're all done with this program, they will have done almost 800 hours of clinical. So we are permitted by our accreditation with the state of New Hampshire and with the CCNE to replace up to 30% of your clinical time with simulation. We actually don't replace it, we add on top of it. So we have more, you get all those hours out in the clinical setting, caring for actual patients, and then we use this facility as well to supplement that training, give you more time to have different experiences, to have experiences that you might not encounter regularly, or do it in a controlled environment where your learning can be assessed and you can have an opportunity to debrief and see what yourself on camera afterwards as to how well you did. So let's show you our student commons as well. So one of the nice things about this building is it does have a space for our students to congregate. We have a lobby. Our students spend a lot of time here between classes and between simulation, but they also have a chance to just sort of visit with each other, and they like this space. So out in the lobby, and we have the other side of the building is our faculty wing. We have a couple of conference rooms, we have some small huddle rooms, and our faculty offices. Did you have any questions that you guys wanted to ask about this?
I will definitely remind everyone to use the chat for some questions right now, but all we have as of now is just somebody saying that they think this is a great tour and thanking us for holding it. So no specific questions yet.
All right. So let's go take a quick walk down. We'll see if we do have a class meeting right now. We'll see if we can. We have a classroom in this building as well. It's so it holds 40 people. We also use all of the facilities and classrooms on campus around the area as well, so that we can make the most use of all of the space that's available to us. So we're back over here into our fundamental skills lab. And then this side, is more lab space with more task trainers and opportunities for people. We got some of our faculty. And so this space also gets used by both our critical care course. Remember, we talked about those who want to learn a little more about caring for patients who are maybe in the ICU. The space is used for that, as well as for our nurse practitioners who come in and learn some skills as well. So on the back wall, you can see some of our task trainers. We have lots and lots of specialty equipment available. We have a fully stocked and completely faked pharmacy. We have a full-time faculty member who manages this and takes care of all of the purchasing, takes care of the hiring, writing the scenarios, and so forth. So we can talk a little bit about faculty. We have 30 full-time faculty members now. They teach with us full-time. Additionally, we hire another 50 or so adjunct faculty. They're part-time people who work in the facility that we send students to. They are nurses who work there, but they like what they do. A lot of them are alumni. They come back and they teach with us in the facility in those clinical settings for students. So we have a lot of really experienced people who have a tremendous amount of nursing knowledge who are sharing that with our students.
Wendy, we have a couple of questions.
Sure.
So first off, somebody would like to know if you could give an example of some research that students are doing in the nursing program.
Absolutely. So we have quite a variety of research topics available that they've done. We have had a student who worked with, like we talked about collaborating with other departments. She worked on redesigning the bedpan, a piece of equipment that hasn't changed in several hundred years. We have had students who work with Dr. Carrie Nolte, who's one of our full-time faculty members. Carrie is exceptionally active in the harm reduction in New Hampshire and has been very active and very successful in creating some great programs so that healthcare providers can do their best to take care of people who use drugs. And so some of them have worked with her program. We had a student who worked with a researcher in Dartmouth to understand the urinary incontinence of 3 seasoned female high school athletes. So that's another type of thing. So there's a lot of different researches available. LGBTQ experiences in primary healthcare, that was one that was just done recently. So that's been if you have something that you're interested in, we probably have a faculty member who knows about it or have access to a community member who would love to mentor a student and work on some research. So we do have some nursing students. They have a class right behind us. It's just getting out. These students have agreed to kind of talk with you guys if you have any questions, if you want to know what nursing is like as a nursing student. So if you have some questions for them, that'd be great. And we'll join them after their class lets out. So this is our junior maternity course, lecture that's leaving. So, hi guys.
Wendy, someone asked if you would say that students in these more specialized majors like nursing, occupational therapy, or physical therapy get to know the professors and classmates better than others on campus. I don't know if you have an opinion on that.
So nursing is really intensive, right? So we talked about the fact that they're going to spend 8 hours in clinical with the same group. They're going to be in lecture with the group. They have lab as well. So our students really do get to know each other quite well. They have a lot of classes that's very cohorted, so you're within the same group. We're going for a cohort. We've increased to about 96 to 100 students now, so it is slightly larger. You're assigned an advisor who is your advisor through the whole program. So it gives you an opportunity to get to know them. Once the professor has had you in their class, they're going to know your name. You spend a lot of time and working with them. We have external activities as well. We have like guest lecture series. We have research presentations and conferences that come in. And so they have a really great opportunity to collaborate and work together. On top of that, we also have a really active student nurse organization. They have a mentorship program where junior nursing students mentor freshman students. So they have a chance to know somebody who knows the ropes and understands how it works and will be willing to show them the way. And then in turn, they will do the same for some freshmen when they are juniors. They also offer some philanthropic opportunities, some social opportunities. And right now, for example, they just wrapped up a Thanksgiving food drive. So they do definitely have a chance to get to know and collaborate with their coworkers, or not their coworkers, their classmates, and with their faculty. Go on. You guys want to talk to us? Sure. We're in the classroom. Is she done? She should be done. Okay. So we're gonna. Oops. Why are your lights not coming on? All right. So this is our classroom that we have in the Health Sciences Simulation Center. It is designed to be a mobile classroom that you can change things around and work in small groups. So each group has a board to work on. But we have 3 students who decided they were willing to stay after. Let's see, how do we want to do it for miking them? Okay.
So Wendy, if they might not be able to hear me, but if you want to just ask them maybe to introduce themselves, and then somebody asked what their favorite aspect is of the new Health Sciences Center, if they want to talk about that as well.
Can I have you guys introduce yourselves?
Sure. My name's Abby. The 3 of us are all junior nursing students.
I'm Allison.
I'm Juliana.
Excellent. So they were wondering what your favorite aspect is about the nursing program here at UNH.
I think my favorite aspect talking about classwork and when we're in the actual classes here is probably the new building that we have. The buildings are beautiful, which makes it a lot easier to come to class and take notes and really be engaged in our learning. But for me, the clinical experience is definitely my favorite. I really, really love getting the opportunity to work with patients and being able to communicate and build a relationship with our clinicals.
I would agree with that. I have a few friends in other nursing schools, and UNH provides an amazing clinical experience firsthand. You get to be in hospitals and talking to patients, which is the best place to learn just hands-on. And you hit the ground running sophomore year with clinicals.
Yeah, I would agree about the clinicals. One of my cousins is in nursing at URI, and he's a junior the same age as me. And he's just starting clinical and a geriatric rotation, and we're in our third clinical rotation. We've done rehab, med surge, and 3 of us on maternity this semester on the labor and delivery floor. So we get a really big, wide range of experiences. And just, as you can see, we're all great friends. Our program's really tight-knit, even team classes. I'm on the board of the student nursing organization, and we run tons of events for bonding, like socials and like exercise classes. We made blankets to donate to pediatric hospital patients. So there's just a lot that goes on, and the professors are all super approachable, and it's a really great program with a lot of great energy.
The professors really, really want us to succeed as well. So although it's a lot of work and it's a lot of physical like presentation in your clinicals, and it's also a lot of homework on the side, professors are really, really available for help if you're struggling for anything, and they accommodate with you if you have a crazy week and you need to get a due date changed for something, or you just need an extension to have some more time to get your assignments done.
Well, some of our professors are alumni, right? So yeah. That is Dr. Alyssa O'Brien. She is a graduate of the from the undergraduate program here at University of New Hampshire, and has returned to teach with us.
So Wendy, someone asked if you could reiterate what hospitals students do their clinical work at, and then maybe we could have our students say the clinical work they've done so far specifically.
Sure. So for hospitals, we use pretty much everything in the facility in the vicinity. So for that fundamentals in the sophomore year, we're going to Northeast Rehab. We're going down to Portsmouth Regional Hospital. They're using some of the long-term care facilities in the area. Junior year, where did you guys go do your clinicals so far? What hospitals have you been in?
I actually got lucky this year, and I was placed at Exeter for both my maternity and my med surge, which Exeter is the close one. It's only about 25 minutes away, so I'm very thankful to be there this semester.
I'm at Elliott for my maternity rotation and Southern New Hampshire Medical Center for my med surge rotation, which is a little far, but it's so helpful because you go to clinical in groups, and you guys can carpool, or like if someone doesn't have a car, most likely one of the 8 people in your group will. So it's not a worry how to get there.
I have my med surge clinical at Exeter, and the 3 of us are all part of a program called DEU that you can apply to sophomore year. So we're actually placed one-on-one with a nurse for the entire semester. So every week we're with the same nurse, which is just a great learning opportunity because you're one-on-one. Someone like gets to know you and your skills and trusts you, and you usually get to do a little bit more, which is awesome. And then I'm at Southern New Hampshire Medical Center for maternity.
So those are the main ones that we use, but like I said, we'll also use Catholic Medical Center, New Hampshire State Hospital. In years past, we've gone to like Maine Medical Center. We haven't gone there in a couple of years, probably last 2 semesters, but that is a possibility of going there as well. If it's of any size in the area, we have a relationship with them, and we try to use them. We do know that sometimes some units are a better experience than others. So one of the things we always do is we ask our students at the end of clinical, what went well? How was this placement? What would you like to see differently? So for example, we did have one unit that the students, they had a tough time. They weren't very welcomed, and the unit wasn't super organized and ready for them. So the instructor for the class went back to the nurse manager and they've created a plan together to how to make it a better experience for students. So we don't just use it just because it's available. We use it because it's a good placement, and we make sure that we maintain those relationships so that we can improve it. So sure, that one group had a hard time, but the one who came behind them, because we asked them how it went, we asked for feedback, and we have a relationship in that hospital, we were able to make it a better experience for the next group that came through. And that's now a really great placement, and people have come out of there knowing quite a bit, because the faculty was willing to ask the students about it. The faculty was willing to put the work in, and then we had the relationship with the unit to make a change, to make everybody happier and have it all work out better.
So someone else asked if there are any clubs for nursing students. So maybe if you want to ask the students to talk about anything that they're involved in extracurricularly to do with nursing, but also things that they do that have nothing to do with nursing, like things that they just kind of do for fun on campus as well.
Sure. So they want to know about SNO, and also any extracurricular activities that you might be involved in, nursing or non-nursing here on campus. What do you guys do socially?
So SNO is the student nursing organization, and everyone automatically who's in nursing is in the is a member of SNO. And so then there's board positions. I think we have about 8. So my freshman year, I applied as the volunteer coordinator. So I've been that for a few years, and I'm a junior. So we just coordinate a lot of events. We coordinate the fundraisers to get like sweatshirts and vests and like apparel, and we do the socials. But the members, everyone who's undergraduate in nursing can come to those events, can buy those, can buy the apparel and be involved. So you don't have to be on the board to be involved in SNO. Everyone is automatically involved. And we try to do a lot of events to involve everyone. We have recently started a mentor-mentee program where you're placed freshman year with someone who's a sophomore. And so we have mentors that are now seniors, who were juniors, and then we have mentees who are sophomores. So it's someone who's a direct resource, who's been through the program. They've been through the exact classes, probably with the same professors that you're in. They're a really great resource for like anxiety for clinical or sim, and just talking to them how they studied for exams, or just having someone to talk to that's been through it is really helpful. So we try to run programs like that. We also have a guest speaker every other week throughout the semester who's a nurse. A lot of times they're alumni from UNH, but we've had people who are in all different disciplines, all different types of nursing, some who have gone back to school in all different parts of the country, that will talk to us and explain their career path and their journey, and get to ask questions so we can kind of see what's out there, because as you may or may not know, nursing has tons of opportunities. So we want to have all the students aware of everything we can do.
In terms of non-nursing, I think it was definitely a little bit challenging for our class and the class below us, just because with the pandemic, a lot of extracurriculars in the whole school, our freshman year, spring semester, we were all sent home and online. And then in the fall, a lot of the extracurriculars didn't happen. Freshman year fall, I was part of a pickup field hockey league, and we would just meet on Thursday nights and have a field hockey game. And it was a lot of fun, but unfortunately it did get canceled the rest of the semester. And then the organizer of that, she was a senior and she graduated. So that didn't continue on, but we kind of took it upon ourselves. There's definitely free time, and even just spending time with your friends, going on nature walks, spending a weekend in Portsmouth, shopping and walking around, being able to go out at night, going out to dinner. Like, you definitely have time to do stuff that you like to do and hang out with your friends and stuff, which is definitely good to give yourself a break, because during the week it is very, very busy with the schoolwork, but you have to give yourself that time, otherwise you'll go crazy.
I agree, and I was part of Greek life freshman year. It wasn't for me, so I dropped, but I know a lot of people that come to UNH. Greek life is a big program here, and there's a lot of people in nursing that are in Greek life, and it is something that you can balance. You just put the work in.
There are even a few students in our major who are on the Division I sports teams here, and several who are on club sports teams here too. So I personally don't know those people super well, so I don't know exactly what their schedule is like and how the director works with them to organize their schedule. But I do know that it's manageable because they do it and they are still in the program 2 years in now.
Right. So we have had cross country runners, gymnasts, soccer. Those are the most common ones that we've seen. Hockey doesn't work so well. Just too many meets for that one, but we give them priority registration, and give them an opportunity to make sure that they get their classes to work around their schedule. We also, our ROTC loves nursing students. That's another opportunity here, which gives you some great advantages for financing your education. And we also work with students who are in the ROTC to accommodate their requirements as well.
We don't have any more questions right now. I'll encourage anybody who has anything specifically while we still have these current nursing students to definitely put them in the chat. But just in case someone does say that, Wendy, do you want to just ask them what is their favorite class that they've taken so far as a nursing major at UNH?
Absolutely. So tell us about your favorite class that you've taken here at UNH.
Nursing or at all?
Yes, you can do one of each if you'd like.
I think one of my favorite classes, since I get freshman year, it is one of the courses that you need to take for nursing, but there are also non-nursing students that are in the class. It's called Making Babies, and it's all about reproduction, pregnancy, the labor and delivery, and after the baby's born. The professor, Karen Nealand, is unbelievable. She is so funny, and she made it really, really entertaining. And she gives you the information in a great manner that you actually remember it. And in our maternity class 2 years later now, we actually are still able to learn some of this stuff. And then for my nursing class, I really like med-surg. I think learning everything in anatomy freshman year it's a lot of material and it doesn't quite make sense to you, but in med-surg, you kind of are actually able to piece it together and like take all the little things you learn and make sense of it. And then when you're seeing it in clinical, it's really cool to learn it on paper and then actually see what it looks like on patients in real life.
I agree with Making Babies freshman year. I suggest everyone take that class. It adds some fun to your education. Like she said, she's a wonderful professor. It's a big lecture. It gives you that college feel where when you go on in nursing, your classes kind of get smaller and you stay with the same group. And I would say as well, either pharmacology or med-surg was one of my favorite classes. It's just so interesting to learn about prescription and drugs and all that stuff and how it helps patients, the pathogens behind how the drugs work in the body. And it's really surprising and interesting. You'll learn so much in that class.
My favorite class is definitely med-surg. It puts together a lot of what we learned last year. We had fundamentals and we had pharmacology, so it kind of combines those two and builds upon it. It's definitely very comprehensive and there's a lot to know and a lot to learn, but it's awesome to get to be in clinical each week. I'm in the ICU this semester and just seeing so much we learn about the process of cardiac and respiratory, and then in this class we put it together how those both affect each other, and then you get to go into clinical and see what's really going on with your patients, and you have like the light bulb moments when the nurse is like, oh, this is what you think is wrong, and you were thinking the same thing. So it's a really awesome class, and it's tied in. It's like our big main class this semester, and we have a sim that goes along with it, a clinical, and then we have class. So we're kind of always doing med-surg, and we have like tutoring, and there's some students that grade above us that run awesome tutoring sessions before our exam. They work with our professor. So it's just a really good class, and our professor's awesome.
Do you want to tell us a little bit about simulation? How about simulation in general and simulation in our new building?
So simulation is a scary word for a lot of people. Even though it's really not once you get in there, it kind of still has the connotation that it's scary. And every time you're prepping for it, I still get anxious for it. But it's one of those things where some people are really good at it and some people just aren't. And you could be really good on paper, really, really know your facts. You could do really well in your patient's room and communication with the patients, and you could still walk into that sim room every week and just get so flustered and overwhelmed and not do well. And that's okay. I think I'm one of those people. I don't tend to do as well in the sim room as I think I do when I'm actually with my real patients. But it's one of those things you just can't get frustrated with it. You need to go in, you need to do your best, you need to stay calm and just like kind of take a step back and really think about what you know and almost treat it like it is a real patient. And I think you kind of have better luck when you just think of them as a real person and try to talk to them and be personable rather than thinking of it as like a robot and as there's someone behind the screen watching you. If you want to talk a little bit more about the process of what we have to do for it.
So if well, sim in general, you guys might not know, we're just so familiar with it, is you go into, it's like a simulation. So it looks exactly like a hospital room. It has all the beds, all the materials you'll need. And there's a mannequin in the hospital bed. And then there's like essentially a window that a professor is behind and they're talking through the mannequin. the mannequin has a pulse, they move, and they have a voice. So you go in treating it like it's a real patient. You're given a case prior, so you're allowed to prep. You're not going in blind. You kind of know the main chief complaint the patient has, their diagnosis, what meds they're on, and a lot of their symptoms. And then you go in, and there's a few different scenarios that can be presented, a few different things that you might know can happen. And it's sort of a way to test your critical thinking skills as a nurse. So you go in and a patient has a really hard time breathing, you've got to put on oxygen, things like that. So it's just you're in the room, and what the professors are trying to do is to get you to think on your feet, because that's essentially what you're going to be doing your entire career as a nurse. And as scary as it is, the professors are here to help. There's a prep that you can go to with the professor. They walk through the entire case with you. And it's also very helpful to use peers and older students, because sim can be nerve-wracking, like Abby said, but it is what it is. It's a great part of the program, and it really helps you learn.
Especially in our new building, we now have so many different rooms. I don't even know them all, but in our maternity class, we have a lab. It's our sim not grade, it's just participation, but there's actually a mom who's pregnant. They like can put the baby inside somehow, and she actually gives birth on like a timeline. Everything goes exactly how it's programmed, and the baby comes out and actually cries and moves, and you can rate the APGAR scores, like how well they're transitioning to life. And then they can also have complications like a shoulder dystocia, and you have to apply pressure. They can have bleeding, a hemorrhage. So there's all different things that our new mannequins can do. There's also a critical care suite for senior year. There's a class offered for that. And there's a bunch of different rooms in our new building, which we didn't have in the old building, which is really awesome. But Civic can definitely be scary. I think last semester when we first started, we all kind of treated it like we were trying to memorize exactly what we were supposed to do. And like if anything went wrong, it was like chaos because we've memorized it. But now I think we've kind of learned when you walk into a patient's room, you're not memorizing exactly how you're going to do an assessment. You kind of, what they present is what you go off of. And you just treat them as a real person, because you wouldn't walk into a patient's room memorizing a list. So I think that's really helpful, and just communicating. And then the sim instructors, they do understand that it can be frustrating sometimes. So you can say like, I need a minute and just take a break. You can bring notes in. So I'll bring like 5 pages of notes. I don't even really look at them, but just in case, worst case, you can look at it. It's a really great experience. It's nerve-wracking, but when you walk out, usually you'll feel good, or you'll feel like, okay, next week I'm gonna go open lab and improve.
Do you think it helps you be prepared for real life care of patients?
Definitely.
I definitely think it does, because when you're going into a patient's room in your actual clinical, the nurses and your instructors aren't able to just decide what they want that patient to have for the day. And with our sim case, they can make the patient have exactly what they want us to learn and exactly what they want us to practice to do. So we do a lot in our simulation lab that I've never actually seen on a real patient, which is nice, because if we didn't have the simulation lab, we would have no exposure to it. And it resembles a real patient very, very accurately. So although it isn't technically real, it like seems pretty real. And I feel pretty confident, even if I had a patient that had some of these things. Like last time we had to suction the patient. Freshman year, we did a lot of work with like colostomy bags, and you guys will learn what all that means. And even just going through it in a simulation lab really gives you a good idea of what actually it is and what you would have to do if you did have it in real life.
I agree. I think it really helps in real life. Our last sim of the semester was a respiratory patient. Like she said, that had a tracheostomy. I have sim on Mondays, went to clinical on Wednesday with my one-on-one nurse, and my patient was a trach patient, and I knew exactly what to do. I was almost able to take over the whole assignment on my own, all because of sim.
And sim definitely does get easier. It's definitely more stressful, more intimidating freshman year, but you kind of learn how to deal with it in your own ways. And the nerves definitely ease as you get older, and you just get used to being under the pressure in the room, and as you get to know the staff.
So Wendy, we do have 2 questions. Someone was asking about minoring as a nursing student. And then somebody else just wants to know more about Durham, about the weather, about what you can kind of do around Durham, just kind of as a town.
All right. So minoring, yeah, and minoring can happen. We have students who are, usually they find something that they're interested in, and they decide that they want to learn more. Popular minors are psychology, women's studies, and foreign language minors. Those are the 3 most common. But that said, you can certainly work a minor for almost anything. There's I think there's 180 some odd minors available on campus. There's a lot of them. You can work with your advisor, both here in the nursing department, and usually the other department will have an advisor who will help you determine your minor requirements as well. And as for living and working on the UNH campus, it's kind of like doing class on a park set. It's beautiful. We back up right here to our building, backs up to the woods. You can just see out there, there's like 100 acres right there to walk through. It is beautifully landscaped with gorgeous buildings. It is New Hampshire. We do get snow in the winter. I'm from California. I'm from the San Francisco Bay Area. I hate the weather less than I thought I would, so snow is not that bad. What do you guys like to do for fun in the area?
So, like we said, we all met through nursing. We're great friends. We're all going to live together senior year next year. We all enjoy, there's a lot of places to hike. You can shop down in Portsmouth. There's so many great dinner restaurants.
Skiing. Yeah.
If you're a big skier, there's tons of mountains. They offer a student pass here as well. And on the weekends, just hanging out with friends. I've never one weekend been here and been like, oh, I have nothing to do. There's always something to do, places to go, people to hang out with.
Me and Juliana live with 8 girls right now, and that seems like that may be a lot, and at times it can be, but we love all of our roommates and we have a really great bond with them. And we try to do a lot of roommate stuff. So like before Thanksgiving, we did a Friendsgiving with all of us, and with the holidays coming up, we're gonna do a gift swap, and we decorate our apartment, and we watch movies and go out to breakfast a lot, go out to lunch and dinner too. And yeah, we just try to have a lot of fun with each other when we have our free time.
Yeah, we have a bunch of friends in and outside of nursing. So there's 3 of us out of 8 that are in nursing that live together, but everyone in nursing also has other friends and other opportunities as well. Another thing that I like to do is there's a bar studio downtown that offers exercise classes. So like I went there on my way to class earlier, and they offer a student rate, and it's pretty much all students in the area, except for also my mom because I'm from here. But it's a super nice thing because nursing can be stressful and busy, and working out is something that really keeps me sane and helps me sleep at night. So there's a lot to do. There's a lot of sporting events. There's tailgates in the fall, which are super fun. We had our last one last weekend, so they're pretty much all fall on Saturdays. And it's just a huge get together of the entire school, basically, which is a ton of fun. Right now, there's hockey games. Our soccer team's doing really well, and there's just a lot of events that you can go to for pretty much anything you can be interested in.
And it's a nice, safe campus.
Yes, definitely it is.
Awesome.
Do we have any other questions?
That is it. So I think we'll wrap up. I want to take the chance. You can tell all the students thank you so much for their time sticking around after they're done class to talk to some prospective students. I'm sure they definitely appreciated it, and I'm sure they could also picture themselves as prospective nursing students and how that can be stressful at times. To everybody watching, I want to thank you so much for signing in. Definitely check out other videos on our YouTube channel. We cover all different aspects of UNH life, and we're definitely going to be making more of them as well. So try to subscribe so you can stay in touch.